I've said this is a webinar to discuss the transitional arrangements to the 2021 GMC-approved curricula and assessment system, incorporating the annual review of competence progression, derogation guidance for chemical pathology and chemical pathology metabolic medicine 2022. So I'm Adrian Park, I'm the chair of the Chemical Pathology CSTC at the Royal College of Pathologists, and welcome. The thing I do need to say, this has all just been finally approved last night by the GMC. So hot off the press, this is all GMC approved, and this is the final guidance now. Next slide, please, Sandra. Throughout the pandemic, the medical Royal Colleges have worked collaboratively to support trainees and trainers and mitigate against the impact of the disruption on trainees' progression through training with the GMC and statutory educational bodies. In September 2021, the GMC confirmed that the approved derogations would remain in place throughout the period of disruption caused by the COVID pandemic. Therefore, to support ARCP panels and to aid flexibility, we have developed joint transitional arrangements and the ARCP derogation guidance. These transitional arrangements are for chemical pathology and chemical pathology metabolic medicine NTN holders in a GMC approved UK training programme, leading to either the award of CCT or CSRCP. We are transferring to either the transitional curriculum for specialty training in chemical pathology or the 2021 curriculum for specialty training in chemical pathology. Next slide, please. These transitional arrangements apply to trainees who entered the relevant training programme prior to the 1st of August 2021. The only exception to this applies to trainees who have passed the FRC-PAF Part 2 examination and whose provisional CCT date is on or before the 31st of July 2023. It is recognised that because of the change in the entry requirement for chemical pathology, not all current chemical pathology trainees will have completed core medical training or acute care common STEM CMT/ACCS and MRCP UK. Therefore, these trainees will be precluded from transferring to the 2021 curriculum for specialty training in chemical pathology because they do not meet the entry requirements. However, the existing 2010 chemical pathology curriculum has been revised and brought into line as much as possible with the 2021 curriculum for specialty training in chemical pathology. Trainees not eligible to transfer to the new curriculum will instead be able to transfer to the transitional curriculum for specialty training in chemical pathology. As a guide, GMC considers 2 years from the curriculum implementation date to be a reasonable transition period for all trainees, and this includes less than full-time trainees, to have moved to this new curriculum. Trainees in their final year of training with the CCT date on or before the 31st of July 2023. Next slide. So general principles. So for chemical pathology only trainees, trainees without CMT/ACCS and MRCP will transfer to the equivalent point of a transitional curriculum for specialty training in chemical pathology. Trainees with CMT/ACCS and MRCP will transfer to the equivalent point of a 2021 chemical pathology curriculum. Chemical pathology metabolic medicine trainees, these trainees will transfer to the equivalent point of the 2021 curriculum for specialty training in chemical pathology. All trainees transferring to either the transitional curriculum for specialty training in Chemical Pathology or for 2021 curriculum for specialty training in Chemical Pathology will not be able to revert to their previous curriculum. Trainees transferring curriculum should proceed to the relevant ST year, i.e. a trainee who has satisfactorily completed ST4 in their existing curriculum should proceed to ST5 in their new curriculum. To ensure the maintenance of the educational quality, standards and integrity in the transition from their existing GMC-approved curricula, to ensure fairness and equity for all trainees, to ensure that curriculum capabilities and mapping are undertaken by the LEPTs and deaneries, and to minimise disruption as trainees progress to CSTC/CP. Next slide. So the recommended minimum data set for each year of training. For the 2022 ARCPs, it is expected that the educational supervisor's structured report will be a key part of the evidence. It may include an indicative assessment of the trainee, mindful of the impact of COVID-19. A portfolio of evidence provided by the trainee for the period under review can include any workplace-based assessments completed, the number of workplace-based assessments required for each year or stage of training is indicative. These can include any undertaking during redeployment which demonstrates evidence of generic or other relevant skills. Any indicative cases undertaken. An MSF, although trainees who have not completed a required MSF but are otherwise satisfactory must undertake their MSF in the following year. Suitable and appropriate alternative evidence. So please see learning experiences listed in the curriculum for guidance. Any college exams completed. Where there is overall evidence that a trainee is generally achieving progress and competencies at the expected rate, but has not been able to provide the indicative number of workplace-based assessments, suitable and appropriate alternative evidence can be taken into consideration. So for preparation prior to the ARCP, trainees will first need to meet with their educational supervisor to discuss the transfer in preparation for their ARCP. The trainee with their educational supervisor must review all their training and highlight any training gaps. The educational supervisor will recommend where they will progress either on the transitional curriculum for specialty training in chemical pathology or on the 2021 curriculum for specialty training in chemical pathology. In preparation for the ARCP, educational supervisor must state in the trainee's educational supervisor reports the capabilities that identify that the trainees still need to meet in the new curriculum and recommend a provisional CCD date prior to the ARCP panel. From the point at which trainees transfer onto either the transitional curriculum for specialty training in chemical pathology or 2021 curriculum for specialty training in chemical pathology, they will have to complete all the subsequent curriculum and assessment requirements within the relevant GMC-approved programme. Trainees will not have to go back and complete previous training requirements. Trainees, though, will still have to achieve all curriculum requirements in the indicative training period for the award of CCT, which will be 5 years for chemical pathology and 5.5 years for chemical pathology metabolic medicine. The college is going to exercise flexibility with regard to the CCT date for trainees transitioning to the 2021 curriculum for specialty training in chemical pathology, which has a minimum training time of 5 years. This means that chemical pathology metabolic medicine trainees transitioning to the 2021 curriculum for specialty training in chemical pathology can retain their existing provisional CCT dates based on a minimum of 5.5 year minimum training time, or complete training in a minimum of 5 years. In all cases, though, trainees must provide sufficient evidence to the ARCP panel that they have satisfactorily completed all aspects of the 2021 curriculum for specialty training in chemical pathology, including all assessment and examination requirements. If a trainee's provisional CCT date is around the 31st of July 2023, the college will allow some flexibility as to whether the trainee is required to transfer. The trainee and educational supervisor should contact the college to discuss further prior to confirming arrangements. It is recognised there will be some trainees with exceptional circumstances, and therefore it is recommended that you contact the college in order that we can discuss and agree an appropriate way forward. And this may even include the need to contact GMC for further advice. Okay, so what follows a series of slides showing the transitional decision guides. So what we'll do is, in a second, we'll get the first one up. I'll ask you just to look at it, but after a period of time, we will progress to the next slide. I will say next slide, we will progress to the next slide. Next slide, please. So this is decision guide for Chemical Pathology ST1 or Chemical Pathology Metabolic Medicine ST3. So we just have a look at this for a minute or so. It's self-explanatory. Okay, next slide. So this is the next guide for ChemPath ST2 or ChemPath Metabolic Medicine ST4. Next slide. So this is the guide for ChemPath ST3 or ChemPath Metabolic Medicine ST5. Next slide. For ChemPath ST4, ChemPath Metabolic Medicine ST6. Next slide. ChemPath ST5 and ChemPath Metabolic ST7. Next slide. Okay, so now it'll be Sandra who'll be taking over the presentation.
Hi everyone, thanks Adrian. Hello everyone, I'm Sandra Dewar-Crichton. I'm the assessment manager at the college, and the next two slides is just a little bit about the LEPT platform. So you can transfer to the new LEPT platform after your ARCP this year. If your CCT date is after the 31st of July next year, then yes. you will transfer to the new platform. There is a bit of good news. Your training items in the old platform will be migrated to the new platform. At first, the college was not going to do this, but we have been contacted by several people requesting this functionality, and the LEPT system developers have thankfully found a way to make this happen. The way it will appear on the LEPT platform is that there will be an additional tab on the blue burger bar on the top of the LEPT homepage, and in that tab they will contain some folders with your with trainees training items, and anybody who has access to the trainees e-portfolio will be able to see that folder. But of course, trainees must ensure that the correct people have access to their e-portfolio. The caveat is that the college training department must have a copy of the ARCP outcome form, whether from trainees themselves or sent in by the deanery or LEPT administrator. The training team will need to update the records on our database and also update the records in the old platform in order to facilitate this function for you to be able to see your training items in the new platform. You will remain on the old LEPT platform if your CCT date is on or before the 31st of July next year. That is a trainee's final year of training. There will be some flexibility depending on cases. For example, if a trainee's CCT date is something like August the 1st or sometime in August, those trainees will be looked at as individuals. And the old LEPT platform will be phased out. This will happen early 2023, late 2023 to early 2024. There will be an opportunity for individuals to save their LEPT training records on their own devices. Bear in mind that none of the training items are lost on the LEPT system. They're all there on the back end. And we have been contacted over the years by several people requesting particularly the multi-source feedback assessment report, which is which they required for revalidation. And all we do, we just give them access to their training records. So everything is intact on the LEPT system, but it will be phased out at some time. So we will be allowing people to download their own training items onto their own devices. Information about how to save all the training records on your own devices will be sent out in due course. And just to say who to contact, if it's anything to do with your ARCP dates, arrangements and decisions, do please contact your local deanery, your LEPT. And any queries on the LEPT system, send them through to the assessment at rcpath.org. Myself or my colleague Michael will pick those up. Any queries regarding CCT dates, they will go through to the training department at training@rcpath.org. And that is the end of the presentation.